I'm Dr. Silva, and I'm here to talk to you about Trazodone. Trazodone is a very old antidepressant. We've had it around for a long time. It's FDA approved for the treatment of depression, but it's hardly ever used to treat depression. In fact, it's never used to treat depression as monotherapy. It can be added on, but in day-to-day practice, what I see, and certainly in my practice, it's used as a hypnotic agent. It's used to help with sleep as a non-habit-forming alternative to traditional sleeping pills, benzodiazepines and Ambien, those types of medications. It's dosed anywhere from 50 to 150 milligrams on up to 300 milligrams for patients that are larger for sleep. But for depression, doses went all the way as high as 600 milligrams. So the doses for depression are a lot higher, and depression takes a lot longer to actually get better, if it's going to get better with Trazodone, whereas the hypnotic effect could be considered a side effect unless we're using the medication as a sleeping pill. In any event, it is an immediate effect. Trazodone has the advantages of being an antidepressant, and so it can only help mood. It could be considered an adjunctive second-line agent to combine with your main antidepressant, just as long as it's not an MAOI, a monoamine oxidase inhibitor. You wouldn't want to do that because of the risk of serotonin syndrome. Side effects of Trazodone include sedation, but that's not a side effect if that's what we're going for. And although it's not approved by the FDA as a hypnotic agent, that really is its main use today. The advantages of using Trazodone as a hypnotic agent in lieu of more traditional sleeping pills is that it's not habit-forming. It can be taken indefinitely. No long-term studies exist, but as far as we know, a person can take it year after year and be fine with it. It's good for the mood. Side effects with Trazodone include dizziness, orthostatic hypotension, which can lead to syncope, fainting. That's losing pressure when you stand up too quickly. What happens is, as you stand up, atmospheric pressure drops by however many millimeters of mercury differences between the top of your head sitting down and standing up. And even just that, just a few feet, just a few inches of difference is enough that your body has to compensate for it by vasoconstricting, like clamping down, particularly the carotids and the arterioles that serve the cranium. And if that doesn't happen, then you can get a loss of blood pressure. You can get a loss of blood pressure that can lead to feeling lightheaded, dizzy, and you could fall or faint. So it could be dangerous, but all you got to do is make sure you stay hydrated and get up slowly. Don't pop out of bed. Really, nobody should be getting up out of bed very quickly or standing up quickly. It's always a good idea to take your time. If it's really significant, a person might have to first sit up, give themselves a few seconds, kind of toss their feet over the side of the bed, let that blood pool if it's going to pool. The main thing is to just move slowly. Priapism is a very rare side effect of Trazodone. It's about 1 in 8,000 men, approximately. It's probably underreported, though. And priapism is a sustained erection. It's defined as lasting as more than 4 hours. It can be uncomfortable and even painful, and it is a medical emergency within 4 hours, which seems like a long time, right, for an erection not to be going away. But it can be a medical emergency if there's any pain or discomfort at all. Certainly go to the ER right away. Not healthy. If you notice that you're having erections that are not resolving, you should stop taking Trazodone and tell your provider right away. One sign that you might be developing that condition or that you might be prone to it is delayed penile detumescence following arousing from REM sleep. So if you wake up out of a dream or in the mornings, your morning erection, if you notice that kind of stays with you, past the shaving and the coffee, then that's certainly not normal, and I would stop taking it. There have been men who have abused this side effect, tried to exploit it. You're much better off getting in touch with your doctor, getting a prescription for Viagra. This can be dangerous. And that's it. It's a very good medication. There's no sexual dysfunction. That's very, very rare, and it's theoretically possible, but it's not. It doesn't occur, and it doesn't cause weight gain in the vast, vast majority of patients who take it. It has mild selective serotonin reuptake inhibition properties, very mild, negligible probably. It's actually a potent antagonist of serotonin 2A receptors. So it blocks a certain subtype of serotonin receptors, and that leads to some antidepressant action and some anti-anxiety action. It's an effective anxiolytic agent as well, but it's also very sedating, possibly through an antihistaminergic pathway. So it's a dirty drug. It doesn't just do one thing. It kind of hits different receptors, and the serotonin transporter and the 2A receptor and probably the H1 receptor. And so you've got different mechanisms of action, but it's very safe, well tolerated. It's got a wide dosing range, and it is a nice alternative. Even if by itself it doesn't result in the best sleep, it can be combined with more traditional hypnotics, sedative hypnotics, sleeping pills, and therefore you can use less of those medications, and the efficacy of those medications is preserved. People can skip nights, or they can use very lowest doses of those other more habit-forming medications.